In the last video, I talked about the role geriatricians play in the care of older adults with cancer. We discussed how geriatric assessment is a major tool that geriatricians use to assess the patient's overall status. Now let's discuss more how performing a geriatric assessment influences the decisions made about cancer treatment for an older adult with cancer. Geriatric assessment is not just an academic exercise, it directly influences the path forward in the very practical ways. Think about it like this. We are moving from a blurry photograph to a high-resolution image of the patient. We will see the details that matter more clearly. Let's discuss how geriatric assessment can influence the care. A standard oncology visit correctly focuses on cancer, its stage, and immediate treatment options. The doctor might ask general questions like, "How are you feeling?" or assess performance status based on just observation. However, this often misses critical issues that are specific to aging population. On the other hand, geriatric assessment intention is to probe for these. Someone might seem fine in conversation, but struggle with complex instructions, forget medications, or fail to recognize and report serious treatment side effects. The geriatric assessment cognitive screening can flag this risk, which is crucial for treatment safety and adherence. Unintentional weight loss or poor appetite might be dismissed as just part of getting older, but geriatric assessment quantifies it. Poor nutrition significantly impairs healing after surgery, tolerance of chemotherapy, and overall strength. Identifying this issue allows for intervention before treatment stresses the body even more. Difficulty with walking, balance, or even basic self-care like bathing that we may identify through the geriatric assessment tells us about the limited functional reserve. This person might be at risk for falls, especially if their treatment causes fatigue or neuropathy, which is the numbness and tingling in your fingers and toes. If we know this, we can provide protective interventions. Undiagnosed depression or anxiety can severely impact your motivation, ability to cope with side effects, and overall quality of life during a very toxic and demanding treatment. Geriatric assessment specifically screens for these, opening the door for mental health support should you need it. Geriatric assessment asks about living situation and caregiver support. If a patient lives alone with no one to help them to get to their daily radiation appointments or manage side effects at home, the whole treatment may fall apart. The geriatric assessment provides critical information about how well an older adult would be able to tolerate the physical and emotional stress of cancer therapy. It helps us to move beyond age and to estimate physiological reserve or resilience. The geriatric assessment doesn't just list other diseases, it helps weigh their severity and impact. Someone with well-controlled diabetes is different from someone with diabetes and unstable heart failure and kidney disease. The total burden of these diseases and illnesses significantly affects how the body can tolerate chemotherapy or recover from surgery. Components of the geriatric assessment like walking speed, grip strength, weight loss, exhaustion, low physical activity are often used to formally assess frailty. Frailty is a state where we are more at risk for falling apart if we are stressed more than what we can handle. A frail patient is much more likely to experience severe side effects, hospitalization, functional decline, or even death from standard cancer treatment compared to a non-frail patient of the same age with the same cancer. Geriatric assessment helps quantify this risk. Geriatric assessment also allows us to identify polypharmacy, which is the use of many medications. It also allows us to flag potential interactions between your current medications and the proposed cancer treatment with the goal of preventing avoidable toxicity in the future. This is where the geriatric assessment has perhaps its most direct impact. The oncology team can personalize the treatment strategy based on vulnerabilities and the likelihood of you tolerating the treatment. For someone identified as vulnerable or frail, standard chemotherapy doses might be too toxic. Geriatric assessment provides justification for starting with a lower dose, using a single agent instead of a combination chemotherapy, or choosing drugs known to be better tolerated in older adults. If surgery seems to be too risky due to poor functional status or illnesses identified through the geriatric assessment, perhaps radiation therapy or systemic therapy like chemo or targeted drugs can become the primary treatment, or the other way around. Sometimes geriatric assessment reveals significant frailty that the risk and the burdens of any cancer treatment, even modified ones, are likely to outweigh its potential benefits. In these cases, the assessment supports an informed decision to forego aggressive anti-cancer therapy and focus mainly on palliative and supportive care, managing symptoms, maximizing comfort, and ensuring the best quality of life. Importantly, geriatric assessment can also work the other way around. A robust 82-year-old might score very well on the geriatric assessment. This provides objective evidence that they are likely fit enough to receive the standard, potentially curative treatment, which hopefully means avoiding potential age-based bias that may have led to undertreatment. Geriatric assessment serves as a needs assessment, showing us where proactive support can make a huge difference in the patient's ability to navigate treatment successfully. It gives us specific targeted interventions before problems worsen. Functional decline or falls risk, refer to physical therapy or occupational therapy. Nutritional concerns, consultation with the registered dietitian. Cognitive issues or complex medication schedule, involvement of the pharmacist, geriatrician, or home health nurse. Signs of depression or anxiety, referral to a social worker or a mental health professional. Lack of transportation or home support, social worker connects patients with the community resources. These wraparound services prompted by geriatric assessment findings are very important for optimizing patients' overall well-being and to make sure that they can actually complete their planned cancer therapy. Finally, the comprehensive picture that geriatric assessment provides becomes very important in communication between the medical team, the patient, and their family. It translates complex medical factors into much more understandable domains like mobility, memory, nutrition, and support. The assessment gives us meaningful and understandable information to have a discussion about risk and benefit. It helps us move beyond gut feelings or age stereotypes. Patients and families can better understand the full scope of the challenges and strengths, which will enable them to participate more actively in choosing a treatment that is aligned with their values and goals. For example, one may prioritize independence over living longer, or the other way around. The assessment also helps everybody to have a much more realistic expectation about the outcomes based on the overall health of the patient. So in a nutshell, geriatric assessment transforms cancer treatment decisions for older adults from a one-size-fits-all approach that is based mainly on the tumor and the patient's age into a highly personalized strategy that considers the whole person. It leads to the care that is safer, more effective, better tolerated, and more closely aligned with the patient's individual situation and life priorities. If you've liked this video, I really appreciate if you hit the like button, subscribe to this channel, and share this video with all of your friends and family members. Until next video, goodbye.